You're listening to Bark and Wag's 15-Minute Vet Talk. Each week, your host, Polly Requa, interviews veterinarians and individuals in the pet industry from across the nation answering pet questions. Bark and Wag podcast is produced weekly for your enjoyment, and show notes can be found at barkandwag.com under the podcast tab. That's BARKNWAG.com. Please remember to subscribe to Bark and Wag 15-Minute Vet Talk.
Thank you for listening to Bark and Wag 15-Minute Vet Talk. Bark and Wag is dedicated to protecting our dogs through advocacy, education, and supporting like-minded dog lovers by selling custom pet products. Bark and Wag is excited to announce our new partnership with a Colorado hemp farm to produce a line of CBD products for your pets. Bark and Wag has CBD pet tincture available in 300, 750, 1200, and 2400 milligrams. Bark and Wag CBD is pet safe, no THC, it's made in the USA, and is CO2 extracted. Please check out Bark and Wag's website, barkandwag.com. That is BARK, to see our line of CBD and awesome merchandise. We love pooch ideas for podcasts and merchandise, so anytime send an email to Polly at barkandwag.com with your suggestions.
Welcome to Bark and Wag 15-Minute Vet Talk. I'm your host, Polly Requa. Today we're talking to Dr. Laura Brown, owner of Green Tree Animal Hospital in Libertyville, Illinois. Welcome, Laura.
Hey, Polly. Thanks for having me.
Thanks for coming back. What I wanted to do is find out what the signs are of anxiety in your dog.
Okay. So we'll start with, there's some different kinds of anxiety. So that makes it a little complicated. Were you thinking like separation anxiety, like when you leave your dog home alone? Or
yeah, I would say, separation. I think that's a big one. And I think it's important for people as people start to go back to work to know what signs are going to be, whether they're going to the bathroom and,
Yep, it's huge. I think that separation anxiety might be more common because of everybody's been staying home due to the pandemic, and so their pets are used to somebody being around a lot more than usual. Especially if people got new puppies, they may never have ever had to be home alone. So signs of separation anxiety and anxiety in general. Dogs get pretty panty, like pant a lot, pace a lot, unsettled, restless, to escalations of like chewing up the drywall and wrecking havoc in the house, and then urinating and defecating and drooling and digging up the carpets and digging at the doorways and jumping on the doors and scratching the doors and things like that, barking, nonstop barking, going back and forth at the windows, things like that, so all sorts of degrees of separation anxiety. And sometimes you obviously know when you come home when there's been destruction or urine or feces somewhere. Sometimes you figure it out because your neighbors, if you're in an apartment or a condo or something, are complaining because your dog's barking all day while you're gone. So those things are, kind of some of the symptoms and things that people might experience. They're all big extremes.
Yeah, so like Maddie, our black lab, I think she has severe anxiety because soon as we leave, she rummages through anyone's garbage. She has like a pattern. She goes downstairs to the girls' room. She'll go through backpacks and leaves a destruction throughout the house. And so what might be some tips for people to get their dogs used to not being at home? I mean, should people start leaving for an hour and gating their dog, or what would be your...
Yeah, some little tips about that is dogs are really tuned into your routine. So if your routine when you get ready to leave is to say, "See you later, Chuck. Don't worry, I'll be back." Get in your crate and throw him a treat, and then you grab your purse, your coat, your keys, and you leave. He knows that you're leaving. So, and then he's been conditioned now to be home by himself for a while. So if he's cool with that, then no big deal. But if that starts him up, the signals start up, knowing what's going on, same for Maddie, then you do have to try to change up your routine. So if you can do it, leave your purse and your keys in your car, your coat in your car, do your routine and sit down and watch TV. Like put your coat on, grab your keys, sit down, throw a treat in the crate and sit down and watch TV and don't leave. And then the next time you really do want to leave, make it a short trip, go small amounts, don't say a word. Just walk out the door like you're going to get the mail. And maybe even do that just to go get the mail, leave them in the house by themselves, just walk out, don't do anything, and then come back and reward them if they were good. So if they've been good, then you have to reward them for being good. So they have to know that when you come back, it's a big party, especially when there's no destruction or anything. Some dogs like Maddie probably should be gated out of the places where the garbage are for her safety. But then the place that you keep her in, the gated area, needs to be like something for her to do, like maybe distraction. That's the other thing. Sometimes I'll have people like fill a Kong toy up with some frozen dog food, so they are busy chewing on the Kong toy for a long time. And they can start doing that, and then you can kind of sort of sneak out for a short minute of time. They come back and they realize, oh, it's not so bad. I had my Kong toy. You were gone. I didn't even know you were gone. Nothing bad happened. So 5 minutes at a time, 10 minutes at a time. So they realize you kind of have to try and condition them into it's not so bad. I'm safe. I have something to do. TV on, radio on, some calming music on, and slowly work your way up to a longer period of time.
Okay.
I mean, there's some other products out there that help calm your dog so they don't have to worry so much, like a thunder shirt. So the other kind of anxiety, storm anxiety. And so when dogs can kind of feel the barometric pressure and know when a storm's coming, so they'll start getting antsy and they're scared of the loud noises and the rumbling and stuff. So there's a product called a thunder shirt, and it's a tight fitting, well fitted, sort of like the whole swaddle thing for a baby. Some dogs it works great for. You got to put it on before they're anxious. That's probably my biggest tip is if you know a storm's coming, you got to put it on an hour before it arrives. You can use a thunder shirt for when you leave too. There's also some products, animal pheromones. Adaptal makes one, or it's made by Adaptal. Vet Classics makes some. They're sprays or plug-ins that emit dog pheromones for calming. So they have plug-ins and sprays. There's also some oral supplements that we use, one called Calming Care. It's a probiotic made by Purina. There's Composure. There's a handful of supplements that are meant to be used for calming. They don't work instantaneously. Some of those that are taken orally need a couple weeks heads up to be in their system well and help them. And then they just stay on them kind of all the time.
Okay.
And then you should, talk to your veterinarian if your dog is like very severe and those small tips don't work. Then sometimes we do put them on medication.
Do they have like ADHD medicine for dogs?
They do. We call it anti-anxiety meds. Yeah. I mean, some dogs take short-term medications, and that's the other push in our world for veterinarians is we're all trying to become fear-free. So fear-free means that your pet won't be anxious when they come to the doctor. And so sometimes that's, now with curbside veterinarian care and because of the pandemic and things like that, that's worked out great for some dogs because they come in the clinic without their owner. That helps a lot of dogs because sometimes they're more anxious because they're with their owner, protecting them and things like that. Other dogs, it's not so good. They're more anxious because they're not with their owner. So sometimes we use a medication called Trazadone as a short situational medication that they give a couple hours before their vet appointment or before the groomer, before traveling, before a storm. And it works just for that instance. And then you don't use it again until you have another instance that you need it, all the way up to some dogs are on some drugs like Prozac.
Okay. I think Maddie's been prescribed, and I think I have a bottle of it, of that Trazodone.
Trazadone.
Or Trazodone. So that's more situational?
Correct. So
Okay.
you just use it. Once again, you have to give it to them a couple hours before you need it, because it takes that long to kind of reach peak effect. And so we use it, and the veterinarians will ask owners that have nervous dogs to maybe give it a couple hours before they come, sometimes because they're nervous about the car ride, but then they're also nervous about coming in. It makes your dog's experience so much smoother. They don't get so nervous about things, and so their physiologic things are more normal. They have a more normal heart rate. They have a normal blood pressure, so it helps us get better exams for them. And it's sort of like, this is my analogy, if you ever had to have an MRI and you have to go in the tube, it's kind of icky. So sometimes your doctor will prescribe Valium to get you through the MRI. Same theory.
Okay. Well, I'm sure most veterinarians can talk to the pet owners about different tips for whatever type of personality your dog has. So it sounds like there's a lot of different options.
Absolutely. Your vets know all of these things.
Good. Well, thank you for being on the podcast, and we look forward to having you back.
Thank you. It was fun. Talk to you later.
Thank you for listening to Bark and Wag's 15-Minute Vet Talk. If you like what you just heard, we hope you'll pass along our web address, www.barkandwag.com, to your friends and other pet owners. Have a pressing question for a veterinarian? Ask your question at barkandwag.com under the podcast tab. This has been a KFR production. Join us next time for another edition of Bark and Wag's 15-Minute Vet Talk.